Assalamu alaikum, greetings viewers. I am Professor Dr. SMA Irfan, a colorectal surgeon. Today I am here to discuss the various treatments for fistula, a complex disease of the anal canal. As many of you know, I have been performing complex treatments in colorectal surgery for a long time. Some of these treatments are exclusively performed at my center in all of Bangladesh and India. In particular, the laser surgery I perform is among the most successful in the world, and I am one of the few doctors who have achieved this level of success. I am here today to talk about this. Specifically, I will discuss the treatment of recurrent fistulas. Those of you who have experienced an anal fistula, a complex fistula, know the frustration of having surgery only for it to return. You have surgery again, and it comes back again. This cycle of repeated surgeries is a very disheartening situation for both the patient and the doctor, as this recurrence is a painful issue. Now, why does it keep coming back? The main reason for recurrence is that when the fistula is high level, meaning it passes above the anal sphincter, conventional surgery like a fistulotomy is not fully effective. To perform a complete fistulectomy, the anal sphincter might need to be cut, which can lead to incontinence, where the patient can no longer control their bowels. Because of this risk, doctors often cannot perform the complete treatment. They may do partial or stage procedures. Even then, the fistula often doesn't heal completely. So what is the treatment for this disease that repeatedly fails to heal? The normal treatment for this condition is very complex. Sometimes it involves creating a temporary colostomy, a stoma in the abdomen, to divert stool, allowing the fistula to heal before reversing the colostomy. Other times, a seton, a surgical thread, is inserted and left in for months or even years before another surgery is performed. These are all very complicated procedures. However, over the past several years, I have successfully treated hundreds of patients with recurrent failed fistulas using laser surgery. In these cases where patients have had multiple failed surgeries, I use a laser. With this method, I have achieved nearly 100% success. The reason for this is that when we use a laser, there is no cutting involved. The risk of damaging the sphincter, which is a concern with conventional surgery, is not an issue with laser treatment because there are no incisions. Since there is no cutting, we can perform the complete treatment for the fistula using the laser procedure. Furthermore, repeated surgeries often lead to other complications like anal stenosis, narrowing of the anal canal, or difficulty in complete bowel evacuation. Even these complications, including anal stenosis, can be treated effectively with a laser without any cutting. So, whether it's a fistula, anal stenosis, or other related issues, we can treat them all with a laser without making any incisions. This means that despite having multiple conditions, the fistula can be completely healed without the pain and prolonged recovery of conventional surgery. All the patients I have treated with a laser for recurrent fistulas are now well and have fully recovered. They didn't have to endure the pain, long periods of dressing changes, or discharge that they experienced with